Hey, I'm Ahava. Today, I'm joined by my new friend, Lorren Pettit, acting CEO of Alliance for Smart Healthcare Excellence, to talk about healthcare website challenges and opportunities. You've got questions, we've got answers. Let's get into it. Lorren, thank you so much for being here. Well, you have a lot of really rich experience, and I'm so excited to share it with my audience. Tell me about smart hospitals and the research you're doing at Alliance for Smart Healthcare Excellence. What prompted you to build this association?
Yeah, so just real high level, the Alliance for Smart Healthcare Excellence is a not-for-profit organization that has been really focused on trying to advance the use and adoption of smart care technology. Now, the real big question is, what's smart care technology? And that's actually sort of what prompted the development of the association that we've set up. Real high level, smart care, there's really no defined, agreed upon definition. But there are a few core issues: human enablement, data-driven processes, infrastructure readiness. To me, the real definition is around what I've cast it as real-time adaptation. To be able to take, these technologies and to be able to use it, with AI, with data processing, and to be able in the moment, from a caregiver standpoint, patient, even the environment, change the temperature, to really adapt what's really sort of going on at that moment. And to me, that's sort of like a real key part of why there's a need for us to understand what smart care is. It's really the new form. Now, to your question of why now, what prompted us? Sort of the history, came out of HIMSS, where I was VP of research there at Chime. I developed maturation models in all those environments, the American Telemed Association. It really was a collusion of a few things. One is that where we have seen this explosive growth in the marketplace of a lot of vendors coming out, they've got the latest solutions on AI. And so we've seen the story before, real chaotic, a lot of hyper competitiveness, and there hasn't been a roadmap. How do you make sense of being able to adopt all this information? Again, having come from HIMSS, where I've developed roadmaps, really sort of recognized that there was this need, this void in the market of being able to provide some guidance around what are other people doing. There's a real baseline of just understanding what other healthcare systems are doing, but then be able to move towards a roadmap, to be able to be informed, very purposeful in our approach. And so that's what we've done. We've launched from the gate was the smart hospital maturation model. And that has really been that sort of tool that is still out there. We're really encouraging organizations to take it. It represents about over 180 hospitals right now in terms of their smart care profile. And then with that, we were really trying to move towards a maturation model. Now, what's really interesting is a lot of vendors have been coming to us and saying, listen, here's that sort of, if you will, the big umbrella of smart care, but we're really interested in this little narrow space. But how is smart care being used around zero tolerance security? Because, when you start thinking of those things, how do these work together? So
Yeah.
that's where we're coming right now.
Can you give me an example of where a patient would actually encounter that kind of care that's sort of changing based on all these new technologies and tools?
Yeah, great question. So we have really sort of parsed, and I would say sort of these different pillars of smart care, how it's really sort of manifest, really around the human experience. There's within the location itself, and then really sort of that back end processes. To your point, the patients themselves may not see all of these things, but a really good case in point would be the ambient sensors that are in the rooms, the patient's room, and to be able to know when the temperature needs to be modified. The remote monitoring of patients, those are sort of things, again, we're trying to make it as seamless as possible. One of the beauty of technology, previous life, I was at Pressgani, and one of the things we often talked about was this whole idea of being able to make technology, bringing it into the clinician-patient relationship. We now really want technology to be just in the background.
So I'd love to dig in though to this because I just dealt with a family member being in the hospital and I was telling somebody about ambient AI and how this is really going to help people. And I said, well, maybe I didn't describe it right. What would you say to patients who feel like, I don't know how comfortable I am with this technology? What's it really going to do? What's it going to record? How do
Yeah.
I know that my privacy is being protected?
Yeah, that really sort of gets to what I sort of like to talk about, the digital culture that healthcare organizations need to
And I know
establish.
you
And
wrote the
so,
book on that.
not a plug, but yes, yeah, I wrote on really sort of fostering a culture, cultivating a culture, a digital culture. But to your point, one of the things also you'd like to always recognize is that patients are not just patients. I mean, there's different segments. My 92-year-old mother has a different approach to technology than my 25-year-old son. So those are the type of things. Yes, with older individuals, for example, that there are privacy concerns. I do like to give the example, though, of where this ambient technology has worked really well. A good friend of mine is a professor at Columbia, and we were doing work around looking actually in the nursing home and fall prevention. And with having sort of sensors that could actually monitor the gait of patients and as they were getting up and all that. And what we were able to do was to predict 24 hours in advance the fall risk of a nursing home patient. Now, you think about the implications of that. There are privacy concerns, yes, but when used with these examples, it's really a powerful, compelling story. How this
Cost benefit
technology. So,
analysis. Yeah, absolutely. I understand that. So let's talk about that book that you wrote on empowering health culture.
yeah.
How can hospitals communicate their digital health initiatives to keep patients informed and excited about advancements?
So one of the really interesting things is, and again, having been in this whole digital world for 20 years, but we have to recognize that we have to take that hat off of the provider and looking at the technology and really sort of what does this mean to the patients? How do we communicate it? How do we bring in technology into that relationship between the clinician, the patient? So it has to be invited for one thing. I always like to take a look that the patients themselves, we have to begin that, we don't want them necessarily to be passive recipients. We really want them to be participants in this encounter. So, being able to tell stories, those type of things are really compelling. I always like to even think about, the architect. Back in the day, we always talked about hospitals being high tech, high touch.
Yes.
Well, can we not sort of merge those two together and cannot you really tech also provide that care? What I did with my with the book was actually sort of lay out a framework. First of all, we have to strategically understand what are we trying to accomplish with our communication and digital technologies. And I sort of lay out, first of all, is it about orienting? There's an element where we want people to be oriented to the organization, and maybe that's where some just want to stop. I have questions about breast cancer, or I have mitral valve prolapse, those type of things that the hospital's website, for example, and different tools that we offer can actually help them move in that area. And then the third realm is what I like to call aligning. Really, that call to action. What is it? Be involved in community groups, or we have things that are involved through our healthcare system. And then finally, the level where we want them to be is that sort of personalizing. Now, it's just more than the patient portal, but there's a lot of things with these, what we talk about, the digital front door, that can really sort of personalize care. And so being able to move patients and family members from being empowered towards being activated, and then that then becomes engagement. And that's sort of the pathway that I was trying to get with this book. And just recognizing digital tools are not just tools, they really are a platform for engagement.
I agree with you. And I think it's important, though, to recognize what that whole generational thing that we talked about.
Yes.
My mother just said to me, I'm sick of portals. I want the doctor to call me. And I'm thinking, oh my God, I love the portal. Like I go in, I find out what's going on. I use ChatGPT to explain it to me if I don't understand it. And I'm a medical writer, so I understand a lot of it. I think one of the things that you're talking about is the fact that I certainly look at my children who are Gen Z, they've grown up with these tools.
Yes.
They would actually do anything not to have a phone call. Like, the phone is a phone? No way. I just think that it's important for us to remember that all this smart technology is very useful, but right now, most hospitals are serving baby boomers. They're not
Yes.
so comfortable. And what can we do to make them comfortable? And I love that, the example that you gave of monitoring the gait for a fall. I think if you say to people, we want to avoid you falling. And so this AI is really designed to make sure that that doesn't happen or predict if it's going to happen, and then we can put more safeguards in place. I think that goes a long way than what we've done in the past, which is look at this cool new shiny object, like you said, look at this cool new technology we have, and not explaining to people why it's really valuable to them.
We deal with, SaaS vendors in hospitals. We talk about the features, but what does it mean to the patients? And speed, safety, control. That's part of the language that we need to bring in, and when speaking to patients about, why this technology is here.
Yeah, it reminds me of the famous Steve Jobs story when he held up the iPod and he didn't say like, oh, it has this much memory. He said, you can hold 10,000 songs in your pocket. That's the emotion
Resonates
right there. Exactly. Makes a lot of sense. You did research at Sway into AI implementation and found some significant differences between agency, tech vendors, and hospitals. Can you talk a little bit more about what your research revealed?
Yeah, so let me just sort of step back a little bit. This type of research is stuff that I've been actually doing since my HIMSS days. Going to the conference, I was the VP of research, and so it was really sort of had a fairly good pulse on what were, the providers, where their heads were, and then also working with vendors and all that. And you sort of go to the conference itself, and it was just recognizing that there was this disconnect. There was a lot of excitement about the shiny objects, and we were pushing this. The vendors themselves were not exactly there. And so I've always been, I think that's really something that's been real significant.
The vendors weren't there or the hospitals weren't there?
The hospitals weren't there in terms of the excitement. I'm sorry. Yes.
The vendors were excited. The hospitals were like, that's not what we need.
Not where, yeah. And so it's just sort of understanding that there is, and it's very important for the SaaS vendors, marketing agencies, to not get ahead of the provider community. One of the areas we looked at was agentic AI and how AI is being used in healthcare. So both providers and SaaS vendor, the marketing agencies were excited about AI. But there was sort of a difference, a lot of it for content development, but agentic AI was like, man, this is where we're going from the agency SaaS vendor standpoint. The providers, though, on the other hand, there's compliance issues. There is a lot of the inclusivity and all those type of issues. And so my concern from all that was we could be talking past one another and lose our relevancy to the providers. And so it was just sort of a shot across the bow. Hey, let's not get too far ahead. Yes, we have to be aware and we have to be looking ahead, but let's make sure it's appropriate and right where the providers are with their thinking.
So I want to press on that a little bit, because here's where I always struggle with this. And I've been doing this for 20 years also. It's like Henry Ford said, if I had listened to the customer, then they would still have a horse and buggy. And so I think sometimes what the vendors are trying to do is they're trying to say, hey, look at this cool stuff that other industries are doing. You're always complaining, healthcare, that you're behind. We're trying to push you forward. Look at what you can do. And then the hospitals or the healthcare companies say, well, we can't do that because of all these reasons. And then they continue to complain that they're behind. And I understand that government regulation is challenging. And I understand that what happened with HIPAA really woke people up. And I get all that. But your research shows that we shouldn't talk past each other. But what are vendors and agencies supposed to do when they say, you asked us for innovative thinking? We're giving you innovative thinking, and you
Yeah.
want to implement it because you're afraid, not because of regulation, not because of some sort of legal or compliance issue, but because you're genuinely scared to take a leap forward. What
Yeah.
would you say to that? Do you agree?
That's it. No, that's actually the reality we live in. And I've been doing healthcare research in hospital research early 90s. That is sort of the reality, the challenge we've had work in a very conservative industry. And so that's a change of mindset of how we have to do. So you're absolutely right that there is a need to be able to push, but recognize that it's going to be a really difficult push. It's going to be measured in maybe years as opposed to months, weeks, which is the frustrating part for those of us that have lived in marketing for a whole long. And we are believers.
I think that in order to work in healthcare, you have to be somewhat mission driven. I myself have been a patient. Unfortunately, I've had loved ones who are patients. And so I've seen healthcare up close, and it makes me more passionate about doing this work. And
Yeah.
when we get
Yeah.
pushback, and the marketers and the communicators agree, they want to do these things, but they get pushback from the executive level who really wants to protect the reputation or the financial solvency of the company or whatever it is. And I get that. Like they're thinking about their part and we're thinking about our part. And sometimes we're
Yeah.
past each other also.
Yeah,
So
it was so interesting. I'll give you a sort of interesting story around the whole Sydney Sweeney thing and how controversy was actually able to move the dial on something. Can we in healthcare marketing, really do that? And, my argument is yes, but we have to be very careful of how much we can sort of push on that. And I think with all the AI tools that we have right now that are out there, that can really help as we shape messaging is to be able to be much more targeted.
I think the important thing to remember is that people have died in order for us to get better at delivering care. And we don't like to talk about that part of it. But if you ask doctors, they'll say, particularly in cancer and autoimmune disorders and things like that, we learn every time. We learn by doing research. And nobody wants to think about that because nobody wants to be the guinea pig or the person who, they performed the surgery on that they found out didn't work, but they kept doing it until they figured out how to make it work. Certainly in breast cancer, you can trace that history very carefully.
Yes.
I agree with you. I think that it's a very sensitive issue because when you think about it in the aggregate, of course you want that kind of work. You want that kind of research. You want that kind of experimentation. That's how you get better. If you're the person, you don't want that. So that kind of part of it permeates the entire industry.
Well, and I would sort of, if I may, I can sort of circle back to the whole smart care thing is because to your earlier point around, some folks are pretty apprehensive on this. Oh, sometimes it's okay to sort of, I think, sort of push the envelope on something and say,
I
hey,
agree.
this is really to keep you safe.
And the risk is that one time it goes wrong and then the whole thing gets thrown away. Instead of saying, okay, it went wrong, let's see how we can fix what we learned from that.
And learn from it, right?
Yeah. Lorren, this has been a fabulous conversation. Thank you for joining me. And thanks to our viewers for joining in. I hope you got the answer you needed today. Please leave any questions or comments in the comment section below. And if you have a burning question you'd like us to cover, please contact me at ahava.leaptag@ahamediagroup.com.